Question 710. Should parents be allowed to withhold medical care from their children?
No.
No. I'm gonna say no, but I'm gonna see where Dave's trying to go with this.
I don't understand why would they do that? Like, as a punishment?
No, like as in blood transfusion. Your child needs a blood transfusion.
No.
And they're a Jehovah's Witness?
Yes, for example.
What if?
What about vaccines?
Christian sites have also run into this situation, and some of the Amish and some of the Mennonites. It's not just JW, although they're certainly well known.
Still no. What about vaccines?
What about what?
Vaccines.
Oh
No.
fuck no. Because it's not just them putting their own children at risk. It's putting other people's
exactly. That's
children.
why they should be fucking.
What about mind control serum and tracking chips?
Well, mandatory, providing the child's not immunocompromised. Add that caveat.
That's not medical
You are
care,
aware that's not
Dave.
medical treatment, Dave.
Yeah.
What I like is that Jeff continued his sentence afterwards.
I'm actually trying to. I don't really think I should know by now not to try and be serious on these fucking streams. You know that by now.
Aunt Jer says never. Joan says in very specific cases, yes. Godless Granny says this shouldn't even be a question. It shouldn't fucking well need to be a question is the issue.
As soon as you give one exception, you've opened the slippery slope.
That's the
What
problem.
we have now is that we've been sliding down this slippery slope since they came up with exception rules, and now we're in trouble.
Yeah.
Well, now you've got stupid things like states trying to put legislation in place to stop medical treatment for people that they don't like for religious reasons.
Yes.
Mm-hmm. Would you happen to be mentioning trans people?
No.
Oh, well, funny that, isn't it?
Yeah.
But it's not
I
just
think
that.
it's the same as. I think it's the same as if you had like a Satan worshiper and they believed in bloodletting with their children. We would think that's horrible.
Yeah.
So the Christians would be like, oh my God.
Yeah.
That's just So what's the difference? There's no difference.
It's
morally wrong.
You shouldn't be stopping what is accepted medical practice. Proper.
I would proviso that with now.
There are former.
Oh yeah, definitely. Now.
Bloodletters that are effective and are used. So.
Yeah, medical practices that are proven to save lives and to help people in certain situations should not be removed from the option of children.
Yeah. Joan says if they have to undergo treatment, for instance, blastoma, you might want to consider the child's wishes not to. The problem is can the child's wishes be independent of a parent? In most cases. The problem is, I think if I'd have told my daughter I didn't want her to have something, she'd have gone in and said she didn't want it.
Depends on what age. I suppose it can be argued depends on what age, but
the little kid is going to say they don't want vaccines because they don't want to get any shots,
Yeah. Like you're a kid, you don't know why you're getting these things. It's just like, oh, I don't like the idea of someone sticking a needle in me. But it's also,
having said that,
and I've got to stress this point. I think that the child is going to be at a certain age is going to be more inclined to listen to their parents than they are to say a doctor, even if the parents are completely fucking wrong and don't know what the fuck they're talking about.
Yes.
Yeah.
And then they get to the teenage years, and the parents might be the ones who know what the fuck they're talking about. They're not going to listen, so
You're
going to have two arguments to support the idea of the children. In one situation, the herd effectiveness of vaccines. That's certainly an argument for them. But the other argument would be that the child and parents don't understand the need for this relative to the whole population, which is the basis of the herd mentality. But that would be different than, say, a medical procedure, like the blastoma that somebody mentions. That's only going to affect them. And is that a valid thing for the state to step in and say, I'm going to control your life?
It definitely is if it would save their life.
And then why can the state control a child's life, not an adult's? Because generally we do have bodily autonomy.
But there has to be a point at which you...
I'm sorry, I didn't mean to make this serious.
It's a serious question.
It is.
It depends at what point, from the child's perspective, that you count them that they have their own bodily autonomy. They certainly do not have it at birth, and you have to grant it to them at some point. But prior to that point, someone else has got to make decisions for them as to what's best for them.
Okay, then why does that say 12-year-old with a form of cancer get to have their bodily autonomy, but the transgender child between 12 and 18 does not?
Oh, no, I completely agree. But the point is, within this context, trans is no different to anything else. Or at least it shouldn't be. That's not to say it necessarily is being respected in that fashion. But there's no, from a medical perspective, if medicine on the whole there is consensus that this is what is required, then this is what is required. This is one of those weird things that there's an awful lot of arguing about these things backwards and forwards outside of medicine, but within there is consensus. There is pretty much consensus on all of it. I mean, yep. I've seen a few cases. We had one last year, I think, about proton beam therapy, treating a child with proton beam therapy that wasn't approved in the UK yet. And the doctors wouldn't recommend it because there hadn't been enough studies on it. It was pretty experimental, and I think it might have helped the kid. They ended up fighting in court and got to take him to Poland or somewhere to get it. Okay, right, and I understand that when you don't have a consensus, there is a debate to be had.
Yes, but when there's a consensus, there is no debate.
Yes.
Yet there is.
Well, there always is, because a consensus just means the majority agrees with something. You're always going to have the minority who disagree, who are going to be loud and vocal and complain bitterly. That's why we have TERFs and gender criticals in the world.
It is. So basically,
and why should a minority of any sort have command over my bodily autonomy, whether it's abortion or transgender issues or whatever? No minority should have that power.
And yet they do. If you enjoyed that, please hit the thumbs up button. If you didn't, hit the thumbs down. If you think you've got a better answer or just want to tell us how wrong we are, leave a comment down below. Subscribe down here for new questions every day, and make sure you hit the bell so you don't miss out on our live shows. If you click over here, you'll see our latest upload. Over here, for what YouTube thinks you'll love the most. And finally, for a complete playlist of all our currently released questions, click here.